Hey guys, this is Michael Pizzullo. I'm a psychotherapist here in West Hollywood. I want to talk to you about trauma therapy and specifically which modalities are best for gay men. So a lot of people go to therapy seeking out help with trauma, and there's a lot of different modalities you can try. But I think there are a few that work particularly well for gay male clients. So I want to go through those with you and why I think they're the best ones if you are, a gay man. So first of all, we think about trauma, we think about something that has overwhelmed your capacity to cope, and something more importantly that has left you with post-traumatic symptoms, which can vary, dramatically in terms of, depression, anxiety, hypervigilance, substance use, so on and so forth. And a lot of people come to therapy feeling as though they have gone through something traumatic or something close to traumatic. And again, there's different ways to tackle trauma in a therapeutic capacity. So gay men in particular often come into therapy with injuries to self-worth and self-esteem because of growing up in a culture that told them they weren't enough and made them feel a sense of shame that they often internalized and that carried along. And trauma reinforces those negative thinking patterns and injuries to self-worth. So it's really important if you're a gay man seeking out trauma therapy that you find the best modality for you. So here are the three that I'm going to suggest to you. So the first one is cognitive behavioral therapy, which is known as CBT. The portion of this I'm going to suggest particularly for gay men is the focus on thinking and reframing paradigms about yourself. So a lot of times people walk away from a traumatic event, whether it was something that happened when they were a child, something in their family system, something that happened later on, with a negative sense of self, a false belief about themselves. And we carry those with those, and those injure our self-confidence and so on and so forth. So I think it's really essential when you do trauma therapy to look for those. Most people will walk away with some negative thinking pattern, and you're going to want to attack those. And CBT is a great way to go through those cognitions and help reframe them and right-size them. The other one is internal family systems, which is kind of a clunky name, IFS, but with IFS, what you're really looking at is your relationship with yourself. It's a little bit of a complicated concept, but the idea is that we all have these different parts of us, kind of like a family, that interact and have relationships. And the idea is that there's all supposed to have cohesion, and we're looking for self-acceptance and self-awareness. And really looking at parts of us that we feel ashamed of, I think, is the crux of IFS. And that is really powerful for gay men because, again, there's going to be some internalized sense of shame for all of us, no matter how accepting your community was or your family was growing up. There's going to be some remnant of shame left over, and so IFS is a great way to do that. And again, it's a great way to work on trauma because oftentimes we feel shame around traumatic experiences. We disown trauma. We often hate the part of ourselves that got scared when we were traumatized. So these are nuances you can go into, but I think it's a really great technique for gay men. And then lastly, group therapy. Group therapy is fantastic. It's obviously different than like a one-on-one relationship with a therapist and client. It's going to be one therapist and then a group of clients, usually between like 4 to 8 or so. But group therapy, it has different benefits than individual. And there's just some things you can't do in a group and versus individual. But I think the best antidote to shame really is group therapy dynamics, because you can obviously work with a therapist who can affirm you and so on and so forth, but there's something different about being in a group and having that being seen and being visible and being accepted. It really is like when you're in individual therapy, you can strategize about how to put yourself out there and make connections and so on and so forth and express yourself authentically. But in a group, you can actually practice that in real time. And again, you have a therapist there and it's a safe space, so things won't get too out of hand. But I would really recommend group therapy as a fantastic trauma modality for gay men. And lastly, too, is that these are just the top 3 that I'd recommend. There's other ones, and you can combine them. You can easily see a therapist who can do CBT and IFS, and cognitive behavioral therapy and internal family systems, and then you can also join a group therapy as well. So you can do all of the above if they interest you. So I hope this was useful. If you have tried certain trauma modalities that you like, I'd love to hear about it. Other ones that I think are really powerful as well are EMDR is fantastic, ketamine therapy is fantastic, but I picked out the 3 that I think are really specifically nuanced and well-versed for gay men in particular. So that's why I'm giving these my thumb of approval. So hope this was helpful, and I would love to hear from you guys about what you've done along your healing journeys.